Hello everyone, I'm Jedlicka, Director of Health Services, and I am recording this video on Thursday, March 13th for your viewing pleasure by Friday, March 24th, 2025. I'm going to start the video with a health update for both residents and our employees. We are seeing cases of influenza A in the community, so we currently do have some staff members and some residents with reported cases of influenza A. However, in our health center, we currently do not have COVID, RSV, or influenza A among those residents and staff. Last week, we did have 2 confirmed cases of influenza A and 4 presumed positive cases in our assisted living. However, as of today, we only have 1 individual who remains under precautionary protocol, and they are finishing up a prophylactic Tamiflu, which was ordered by our medical director, Dr. Butler. I've been in communication with both with our health department from the state side, and then also with Johnson County Public Health. Johnson County is reporting a lot of cases. So within the community, the broader community, they're seeing a lot of influenza A. They actually were very optimistic in regards to our numbers and did report to me that our numbers are currently low, and so we hope to keep them that way. So the important guidelines to continue to follow: stay home if you're not well, wearing a mask, so if you're symptomatic or if you need to leave your apartment to get to an appointment and you're not feeling well, please wear a mask. We are currently utilizing masks in our assisted living, and we believe we're going to follow that protocol for another week, again, as precaution. We're not seeing any new cases, but just to be safe, we're going to keep masks on for 1 more week in our assisted living setting. And if cases continue to increase, we may be asking for masks to be worn a little more regularly, but we're still in that monitoring phase because our numbers have remained low on campus. Remembering that you have meal trays, so you can order a meal tray if you're feeling sick. This helps to keep you out of the dining room setting, which mitigates the risk of increased spread. And then a reminder to you that at your local pharmacy, there are COVID and influenza test kits. These are very easy test kits to use. They're fairly inexpensive, so that's something that you could get a quick result if you're not feeling well and you maybe just want to do a quick test on yourself. The local pharmacies carry those test kits, and they're very convenient. In regarding our health center and our census, we remain very high with our health center census. Actually, as of today, we are at 59 out of our 58 health center spaces. And what this means is that I contacted the state of Iowa, Department of Inspections and Appeals and Licensures, and we have done what we call a 1-over waiver. So we do have an individual staying in our lounge area, which is a beautiful setting, and it works very well for this situation. It does have a bathroom that is right next to the room, so the accommodations are just fine, but we do have to waiver up 1 space. I believe the last time that Oaknoll had to do the 1-over waiver was back in September. We do anticipate that we have some transitions coming. 1 individual will be rehabilitating back to assisted living, we hope within the week, so that will again free up some availability. But I do just want to thank everybody, the team, the residents, for understanding and for the cooperation as we manage our resources effectively to support the residents and the needs. I'm happy to announce that we do have a COVID booster clinic scheduled. So we're excited to share that the date has been set for the upcoming COVID booster clinic. Many residents have inquired, and we're glad to provide you the details on this video update, but please also keep an eye out on the weekly memo for more updates. The clinic date will be Tuesday, April 8th, and this is for the 2nd dose of the COVID-19 24-25 vaccine. For independent living, the location will be in the Hayden Room here on the main campus. The schedule is that from 9 o'clock to 11 a.m., the pharmacy team will be in the health center and in the assisted living, administering the vaccination for those who consent. And then from noon to 2 p.m., the vaccination team will be in the independent living Hayden community room for the main campus. And from 3 to 4 p.m., the vaccination team will be at Oaknoll East. So your eligibility requirements are that you would need to have received the previous dose of the 24-25 vaccination. And we did this clinic approximately 6 months ago. So if you're up to date with that, then you're eligible. And then it also needs to be 6 months since your last dose of the 24-25 COVID vaccine. So we'll just need to confirm this, and there'll be consent forms that are provided. So please note that this clinic has been purposefully scheduled 6 months past that last clinic, which the last clinic, March 20th, gets us past that 6-month date, which is why we scheduled this for April 8th. So if you have any questions, please reach out. Happy to help answer those questions. And we'll be excited to have this clinic done. The team works really well together from what I've heard, so I'm excited to be a part of this. My final update for this week's video is that we do have a team that will be visiting New Orleans. So next week, there's 4 key team members that are going to be going to New Orleans for a few days to explore a small house that is already up and in operation. So we're going to be engaging with the leaders on innovative approaches, the design, development, and the operations of this project. The team members that are attending include Steve Rowe, CEO, Sarah Rollman, Director of Nursing, Taylor Wheeler, Assistant Director of Dining Services, and myself, Amber Jedlicka, Director of Health Services. This visit presents a great opportunity for us to learn and share ideas that can help us to improve as we prepare to operate our small house. I will see you all for my next video update in 3 weeks.